I'm excited. Got the feeling today's going to be the first day of a whole new me. I had gastric bypass about 3.5 years ago and I lost 140 pounds. It's kind of a conditioning. So when I look in the mirror, I'm still not tremendously satisfied with what I see. I do see the weight loss and I do feel amazing, but I still see my imperfections. I think after this surgery, I'll be able to really clearly see the progress that I've made without the loose skin being there.
Dawn is healed up and is ready to show off her results. Are you all ready?
Yeah!
Dawn, come on out.
Woo! Welcome.
You look amazing.
Marilyn is in the house.
Wow.
Thank you. Thank you.
What's the biggest change for you since the surgeries?
Probably my self-confidence is through the roof. I no longer hide behind my clothes. I feel good. I can finally wear form-fitting outfits and not feel embarrassed by the loose skin that I had. I can wear beautiful panties from Victoria's Secret now.
There you go. I want to introduce plastic surgeon Dr. Roger Bassin of Bassin Center for Plastic Surgery. Tell us a little bit about your surgery. And as happy as Dawn is?
We're happy too, of course. And what we call this procedure is low-cut tummy tuck, because what we want to do is be able to give you a result that you don't have to have an incision that's visible and that doesn't show to everybody. So you can get into your bathing suit and you can get into the two-piece and
Victoria's Secret.
Victoria's Secret and the low-cut panties. And it's interesting, there's a lot of patients that we're seeing, and I'm sure you as well, that patients are actually camouflaging their tummy tuck scars with tattoos.
With tattoos.
And, you know, so it's an issue, how to camouflage these types of incisions, and, you know, did an amazing job being able to really plicate or tighten that muscle wall, really pull down the excess skin, pick the pubic area up as well to flatten that out and really give her some nice definition. And she looks great and she's happy, and that's the most important thing.
And we would be remiss if we didn't say one last final step, right, Dr. Bassin? What's that?
Absolutely. And you know what? You're inspirational. You've inspired everybody. And you know, I think that this is going to continue to inspire people. And a lot of patients who've gone through a weight loss journey need to understand that you're kind of connected in that regard to a cosmetic surgery that's going to come along afterwards. You know, and a lot of times you look in the mirror, you've lost all the weight, you feel great, but you're looking in the mirror and you still, you know, are reminding of your past transgressions. So we want to be on the journey with you, to continue with you, and to take all the excess skin off your arm, and to help you to get your breasts back to where you want to be. And we want to be side by side with you when we complete that.
Thank you. Thank you. Thank you. I really appreciate it.
Dr. Bassin, thank you so much.